we are going to respond to an European call for project, and there we're going to present the project and the protocol design of this call. So we are all from Grenoble, and for this presentation with Pauline and Lucie, we choose to first present the project, the call project, the protocol design, then what is the protocol in practice, what we have do until now, what has been achieved until now, and we are going to answer questions just between us. So the call for projects. So it's an European call for projects. It's done by an European Union organism called EITF. This organism promotes entrepreneurship and innovates in healthy living and active aging. The aim of this organism is to improve quality of life and healthcare across Europe. So in each country. Welcome. We just start. Yeah. So as we just start, I'm going to begin again. Sorry? It's an English workshop, so we're going to do it in English.
From Dakar?
So welcome. So as I said, we are from Grenoble. For my medical thesis, we are going to respond to an European call for projects, and in this presentation, we're gonna show you the protocol design of this project. So for the presentation, as I said, we have different parts, and we're gonna start with the presentation of the call. So first, there is an European call for project done by an European organism called EITF, which promotes entrepreneurship and innovates in active aging and healthy living. And the aim of this organism, as I said, is to improve quality of life and healthcare across Europe. In this organism, there is different programs, and one of them is the Innovation Project Program, which supports, gives funds to new ideas and new projects. So for universities, it's an opportunity to have funds for generating new ideas for healthcare. EITF is the first European initiative bringing together business companies, higher education institutions, and research centers to improve the collaboration and to increase the work between these three sides, between business companies, universities, and the research centers. The aim of this work is to facilitate the transition between student to entrepreneur, then idea to products, and then lab to customer. Is the aim of this organism. Different ideas can be supported as lifestyle interventions, ideas about nutrition, ideas treating chronic diseases, ideas about social care, or ideas improving healthcare systems. So this organism gives funds to these projects. So for our university, the protocol is piloted by the Europa Association with the president, Dr. Zakariae. So it's an association with specific rural GPs, only rural GPs. So we have this project to work on rural practice, which is a specific kind of practice. The project choosing also to work in different countries, so in different rural countries across Europe. And we choose diabetes as chronic disease. So we choose to improve the management, the treatment of this kind of pathology. And our goal is to improve autonomy and quality of life for elderly people who are diabetics in rural areas only. So our project is to put in place an internet platform to facilitate exchange, education, follow-up between diabetic patients and health professionals. So it's our project. Why we choose to do that? Just because in rural practice it's quite difficult to go to the GP office because the distance is quite long. And our goal, our specific goal is to improve patient empowerment, just to prevent the risk of complications and hospitalizations. So if we can win time and for the management of these patients, of these specific patients, it will be fine. It's our goal. So for that, in practice, we try to develop a website with different tabs. One of these types is a tab about the follow-up as clinical follow-up or biological follow-up. Another type is about nutrition, as we can give recipe ideas, we can follow up the weight monitoring. So we have a tab about nutrition. Another tab is about physical activity. So we can organize group lessons with physiotherapists, or we can give some advices to the patient. We can also have a tab about information data sheets, so we can give advices to the patient to have a good management of hyper or hypoglycemia, or we can give them quizzes for the evaluation of patients' knowledge. And another tab is about the communication between health professionals themselves and between patients and professionals. So we can have written exchanges or photo sharings. So what we have do until now, as an European call, we have different countries included in this project. So in France, we have the specific university which is Grenoble-Alpes University, our university. We have the MSA, which is the agricultural social security system, a specific social security system of rural patients. We have also universities in UK, so we have some contacts with the Imperial College. We have some contacts, but we don't have all the agreements. We have also a contact with the Innovation Agency of the Northwest Coast, which is in Wales, maybe, or Ireland. We have contacts also with Chester Hospital. We have contacts in Germany and in Spain with the University of Barcelona and with the Madrid Hospital. And as business companies, we have actors in our project. We have partners in Scandinavian countries as well, specific in Stockholm. So our project, to summarize, is to put in place a website to improve the quality of life and the autonomy of diabetic patients in rural areas to give them an autonomy and a self-empowerment to increase their quality of life. So it's the project. Have you got some question about this presentation and this project first? Then I think we're going to work about some questions we're going to ask you. Yes.
Thank you for your good presentation.
Thanks.
My question is, what about African continent? We have contact?
Yeah. No, we haven't got any contacts, but the call is a specific European call, so we have only European countries in this project. But why not in the future to have a world impact? I think it's a good project. We had some contacts with Wonka presentation in the past presentation. We had some contacts with one of them who asked us to make a presentation last year, the next year in India for that, because it's an interesting project for that.
There's two aspects to answer you. One is around the research project, and this research project is a call for project coming from the European Union, and we have to respect the rules of the call for projects. It's kind of Massachusetts Institute of Technology in Europe, the European Institute of Technology, EIT. That's the idea of this call for projects. But the other aspect, the second point, when this research project will be achieved, I hope, the website will be created, and we can imagine that a website is useful for many population, not only in Europe. If it's on the web, it could be used in other countries. So I can imagine that that kind of website could be used in Africa too, maybe with many translation of the interface of the text into the website, English, French, or other languages could be useful for other countries and not only European countries. Diabetes is not a European disease. It's a worldwide problem, and it's the reason why India could be a great place to present the
idea of the project.
Yeah, the project.
But we have to consider in a website that it's not only a problem of translation or about language, but it's also a problem of health organization system. For example, I suppose that in Senegal it's quite different than in France or in Ireland or this. And we have to take in account all the guidelines from each country. Local organization and skill, because they are not the same.
Skills and the pathway, the patient pathway is not the same from one country to another, and
the medical law as well.
It must be adapted.
But not only with Africa, between all the European regions consent, it will be difficult. Because it's not in Wales and Scandinavian and in French regions. It's not the same to organize healthcare for diabetes patients.
how do you go about organising new projects to slot into that? Do you have a sort of system if someone wanted to do some more research that you would then share on your website, or are you only looking at the rural care of diabetes specifically at the moment?
I didn't understand all the question. How we can...
So so say someone was to research the care of,
Yeah.
I don't know, other conditions in the rural setting or even in an urban setting, just widening that research, how would you go about using new projects and potentially implementing them into your website? Does that make sense?
I think, that is my opinion, but I think it's a very good question in the US, because, as I say, each population, each region are different, and we have to give specific tool regarding each region we choose. And probably, even in UK, the rules are not the same between Welsh and England and things like this.
Mhm.
And we have to think about that. That's why we would like, probably we will be associated with Atos, which is a firm for computers and things like this, able to do something very well fitted for all the population we have to consider.
One thing I thought was quite interesting was that you're using the internet as your way to disperse that information.
Mhm.
But actually, if you're aiming it towards the older population, a lot of elderly people either don't have the internet or
Yeah,
don't know how to
yeah.
use it particularly well.
Yeah.
Have you had any thoughts as to how to access them?
In a way, things are changing, and more people, even
Yeah.
elder, are connected. And the second thing important is that in some rural place there is a community, and not only an isolated person.
Mhm.
And we want to share, we want to inform with all the patients and in his or her community. And I think it's something important to exchange, to have peer review in a way, something like this, with the elder and younger probably, with the website. And it's a tool we can be more easy for people to connect, but not. I understand it's not like you are
Yeah.
all the day typing on your smartphone. But for the elderly, I think it's something important to exchange and to share with the community. We have to think.
All stakeholders are involved in this program, not only the patient,
On y en a
but
rien.
nurse, the family, the legal pharmacist, social workers.
So you've got sort of very specific organisations there that you've listed internationally, but say, I don't know, in England, for example, we do research in the rural setting and found some things. Would we be able to then put that into your system? Or do you have any
We can do
rules
that.
of what you're using? Or
In online, it's totally open.
Yeah. Yeah. The project is not closed. We have. It's one of the points we can speak about. It's new ideas we can put in this project because it's not very closed. We are open to
I
ideas.
think that the aim of the European Union with this project is not to be open to everybody, because it's the initiative. It's at the beginning, and because there are problems. The problem of Europe is that the population is more and more aging, and we are afraid with people who want care, more and more care, and disabled and things like this. And what they are afraid about that. And the question is, probably we could not more autonomy, probably it should be better. That's why we try to combine something. And we don't choose the country by the European call is specifically for this country. Not all the countries are eligible. For example, we can put on Poland or Italy. I would like to put them because I have a lot of people interested in who can work, but I can't.
In the specification of the code.
Yeah.
Can you forward this presentation or make this in the key?
Yeah, there is. I give the authorization to put it in the website.
All presentations with
Yeah.
the authorization of the authors will be on the website of the Congress. When I don't know, but it will be.
So I think you want to. Yeah, we can go to the question. So for our first question, to improve this project, to to have new ideas and to have some advices.
So Zakariae will explain
Yeah. So for our first question, we're going to speak about the population. For our protocol, we choose to speak about elderly people in rural areas who are diabetics. In your mind, do you see other exclusions or inclusion criteria we can add to our population? What do you think about this kind of population, this specific pathology, specific area, and specific people?
I guess it's easier to define age. You just use a number. But by what mechanism are you defining rural area?
Yeah, there is no. It's a problem.
Yeah.
It's a problem because there is no universal definition of a rural place. In France, we have a statistic definition by the National Statistic Institute, less than 2,000 people kilometer square. It's like this in France. It's not the same in all the countries. The European Union have another definition. The WHO have got another definition. So there is some specific way to answer this question. Social searches define this with the people who are living there, and people say themselves that they are rural, so we said that it's a rural place.
It's a feeling
Yeah, so that's a problem for a research project because we can't use this kind of definition, and we can't ask for each country and each region's people. Do you feel? Are you rural or not rural? That's a little bit difficult.
And it's the same, I think, for age. It's not easy to define age because we can say that elderly people is more than 65, 70. How do you define the age? Because, sorry, Jean-Pierre. I don't see it. Yeah.
You cannot define age.
Yeah, it's quite difficult. Age.
The problem is, effectively, it's a joke, but is it 65? Is it 75, for example? We have to define it. Yeah. And probably the life expectancy for each country can define the age of the
Yeah, it's quite difficult because it's an European project, but
The same problem for Africa.
Yeah. Yeah.
The same life.
Oh, I was thinking you're actually using age as a surrogate marker for mobility, really. So what, you're not actually looking at, to me, whether or not someone is old or young.
Yeah,
What
yeah.
you're actually looking at is whether or not they are capable of traveling easily to a GP surgery
Yeah.
or not.
Mm.
So I wonder whether looking at a patient's mobility, their transport means, would actually be a more accurate way of assessing that in a
Yeah,
repeatable
right.
format.
Yeah, yeah, because our project is to improve autonomy, so we can define the age about autonomy.
Yeah.
That's a specific population we want to work
Mm.
on.
But there's a huge difference between someone who is 70
Yeah.
but is, fit, has their own car, can easily get to the GP surgery. That's not a problem, and they're kind of irrelevant to the purposes of your study. Whereas you could have somebody who's actually, 45, but due to their chronic comorbidities, their mobility problems, they actually fall into the group that I think you're intending to capture.
So
That's
this way,
Yes, I understand, because it's difficult also to define the disabled. Also, it's difficult.
handicap and disabled.
Yeah, because we have criteria for to define the level of disability of handicap. And
Do you use a formal frailty score in France?
we use
ADL, for autonomy.
we say we use ISO group of autonomy. We have the 5 and 6 that we are like me, like you, and 1 you are in your bed without not able to do nothing. Okay. And we have 4, 5, 4, 3, 2. And this is made to give some pension, some money people. If you are at the 6th level, you have nothing. And if you are level 1, you have more money to manage your care.
Yeah, so I wonder whether it would be helpful to look at the population you've already looked at and see where they would fit on a formal frailty index, and then perhaps consider rolling that out to people of different ages, but then who would then fit that, and that would perhaps be more repeatable in different countries.
Not only the age, but also the frailty.
Yeah, or instead of age even, because it's really not about how old they
There is
are.
some scale of frailty, so we can use this.
Yeah, and I think if you have a numerical scoring system,
Ouais.
that could potentially make things a lot clearer.
I think we can include for each country, as you know, probably different. We can use this kind of tool and to have the population with, for example, for criterion less than 3 or thing like this.
Yeah, to put different criteria.
Okay, good idea. It's important. Have you other comments regarding the population? Have you other comments or other proposal regarding the population?
I presume you mean type 2 diabetes? Or are you also including type 1?
Type 2 diabetes, because type 1 is not really very common, first. Second, there are mainly, I think, diabetes to type 2.
And not-
Diabetic education is not the same.
You have the population with, sometimes you have with type 1 or type 2.
Sure. And then you're using mellitus as opposed to insipidus.
Diabetes.
Yeah.
Are you only
So we have to choose. We have to choose. We can't do
Or,
for.
yeah, just
We
sure.
can't to create a project for multiple pathologies. We have to choose the one there. We could do the same for. It would be interesting, but we decided to focus in one direction.
Mm.
This is a goal for project. We can do everything that we want.
Why we choose diabetes? Because
We have to keep in mind realizable.
Because if we
Be able
succeed,
to create
if
this.
we succeed on this part, we hope we will do a second part. It's about the feasibility here, and if we succeed, we will do and control trial with population without intervention and population with intervention. Okay, and it's easier for the diabetes because you have hemoglobin like this. For some other chronic mobility, it's more difficult to have the number.
yeah, and it's a frequent disease, so we can have a population. We can study the impact of this intervention. We can follow the intervention and how is going the patient with this intervention and how is going on.
Moreover, there are several technical aspects that could be developed, especially for diabetic people. And that's one of the aspects of the specification of the IT, it's the T technology. So we have to think about this, to get some helps from the industrial partners.
So are you simply using HbA1c to assess so hemoglobin to assess the diabetics going forwards, or are you using any other measures to assess?
In this project or in France for the guidelines you're speaking about? So for this we try to improve the autonomy and the quality of life of the patient. We don't have a medical project. The goal is to improve the autonomy, the quality of life, to improve medical aspects. Our goal is not to improve HbA1c, because we haven't got a medical project. It's a social, global project, not specific medical project.
Yes, and it's also difficult because reading the papers, scientific paper about HbA1c, it's intermediate criterion, and it's probably not the most relevant for people.
Mm.
So I just wondered what you're using.
We made a study, and we were very hard for the patient. We made a lot of drugs, and the objective was less than 7. IB, less than 7%. And when we compare the two populations, we have the population we have the level less than 7% between the other group. This group, we have more death. And so we must be very careful with the HbA1c. You understand?
Yeah. So what you're actually assessing, or to my understanding, is patients' quality of life.
Yes.
So do you have an assessment or a scoring system that you're using? Is it a questionnaire with specific repeatable questions that you're using to assess the quality of life? Or
We
you,
have the QF26,
yeah?
and I think it's
Yeah, the L on-
most
at the-
used in the World with some specific questionnaire regarding the problem with the artery. Yes, and we can use them, but at the moment we can say we will use this, and this, because probably it should be different from in Spain or in UK or in France. Probably quality of life 36 is the best. It's very well used in the European country, but other must be considered.
So for the intervention, the question is which health professional would you like to involve in this project to improve the autonomy and again the quality of life? What kind of professional you are thinking about? We can think about nurses. We spoke about dietitians. Anything else?
Have you any other proposal? This afternoon we were with Steve Moore and we speak about social worker.
Yeah.
Probably it's something important.
Do you use healthcare assistants?
Healthcare assistant probably, but also we I don't know if this exists in other countries, but we have in France a national association that more than 2,500 local association, which is called ADMR, Rural Health Association for Autonomy. The translation is that. And you have a lot. You have social worker, you have nurses, you have physiotherapists, something like this. But you have also a lot of benevolent, free contributors. Yeah, voluntary. And I think it's something important to make more links in the population.
The community,
In the community.
Care.
There is a stand in this congress of ADMR.
Yeah. And but probably in Africa you have other proposal, because I think you are less individual than in European country probably. I suppose I don't know exactly. I think.
Yeah. So in this part, we thinking about we are thinking about the place of the patient regarding the website. Do the patient have an active or a passive direction? Yeah. Do the patient give some information in the website as blood results or the weight he has got? Do the patient have an active or passive comportment? I don't know if I'm clear. Yeah, behavior.
Sorry for the pronunciation, pronounce. But in my opinion, I think they must be really active.
Yeah.
Because sometimes doctors always consider patients as something lying in bed. There is a life, and they must be alive. And I think if they are really active and they can interact with other patients, with the community, and with the website, and with, by the way, with the doctors and all the health workers, I think it should be better for them. I haven't found nothing in the bibliography, but I suppose what is.
Yesterday we met the Canadian professor called which is a professor from University of Laval, precisely.
Yeah. As we said, because there is different laws in different countries, we don't have the same laws. We have some restrictions in France to give confidential informations in website, because it can be some problems, some confidential problems. So we have to clarify this aspect, because it's medical information, so it's confidential. So we have to be careful with that.
I think that it could be like objective of treatments that the patient decided to have, not only the doctor
Yeah.
decided what is the precise objective for the patient.
Mm.
That's that kind of situation with a like cursor, and the patient can imagine I want to be more free or to treat more, but with a safe condition.
Mhm.
That the patient decide.
Yeah. It's our goal to improve autonomy. I think we spoke about this part because we spoke about scales we can use to evaluate the impact of this intervention. So maybe for autonomy, QF36 is the best one.
And do you know other scale to evaluate the autonomy and the quality of life? In France, we use QF36. We use also, we have other, but it's for dementia. We have other scale, but it's about for dementia, for Alzheimer's syndrome and things like this. For autonomy, we have sometimes but we doesn't really measure. We have to, sometimes we fill papers for patients, we say he can walk less than 50 meters or less than 100 meters or things like this. But we never
Yeah.
never measure.
Mm. Just approximative.
It's a general thing. We have independent scale which we use, and we have a mobility assessment called the tug test or the timed up and go test.
Yeah.
Yes, the time you go around your chair.
No, you have to stand without
Yeah.
using your hands
Yeah.
from a chair. You have to walk, I think it's 3 meters or 10
3
feet.
meters, yeah.
Turn around and come back and sit
Yes.
down as an assessment of mobility in the elderly.
In France, we make the turn of the chair.
All right. Similar.
The same.
Sure.
Up and go test, and we call it up and go test.
Yeah.
Have you something like that in Senegal? Or no? Have you other scale to measure the autonomy in the Senegal?
In Senegal?
No.
Les échelles de.
I don't know exactly. Senegal?
Okay. I think it's probably another proposal, because we say the third question about physical activity, psychic activity, group activity. I think it's something important to consider the whole organization.
Mm.
And have you any suggestion?
about fields we can put in place in the website.
But in the public health in Senegal, you can have
So I think with nutrition, there's a lot of confusion with regards to diabetes, calorie counting, that kind of thing. With cyclic activity, we use a lot of mindfulness now for CBT workshops, things like that. With patients with chronic conditions who are struggling psychologically, we
Yeah.
have that.
Mm.
There's a lot of online mindfulness
Yeah.
workshops which
Mm.
patients can work with if they like.
Yeah.
That and group activities, so things like support groups or
Yeah.
sociable groups where patients
Yeah.
can meet other
Mm.
patients and similar things.
Yeah.
In France, we promote the walk. We promote the walk.
Walking.
Yeah. Some activities like walking or some group meals to eat each other's.
Yeah.
I think it's a way to have a nutritional impact and a social impact as well. Just for elderly people to not eat alone.
Food work.
Yeah.
Well, I think studies have shown that, especially patients who struggle to know what they eat, but also are not eating very much, they do a mirroring thing, and
Yeah.
especially the elderly. So if an elderly person sees someone else eating, they're also more likely to eat their food,
Yeah.
because that's the social norm,
Yeah.
which you cannot
Yeah.
come away from.
Mm.
Similarly, if everyone else is walking.
Yeah.
And the problem also is with chronic mobility, people could not walk sometimes with arthrosis, something like this.
Mm.
That is a problem.
Thinking in terms of complications of diabetes,
Yeah.
you've actually got patients on dialysis, with renal disease, you've got patients with amputation,
Yeah.
with vascular disease.
Yeah.
You've got a number of subgroups which you
Mm.
can choose between,
Yeah.
which are very much not equal
Yeah.
in terms of evaluation
Mm.
of quality of life.
Mm.
It should be the second part of the study to compare all the
Mm.
different.
And it is why it's interesting to work about diabetes, because it's a global
Yeah.
study. Yeah.
I guess you have to be wary when you did your study that you included a similar proportion
Yeah.
of people with each type of complication
Mm.
of mobility following
Yeah.
on,
Mm.
because otherwise the quality of life of amputees
Mm.
will be
Yeah.
significantly
Mm.
less.
Mm. Yeah, you're right.
I don't know if that changes in different countries either. In UK, probably France, I don't know, but they're very, very hot on examining patients' feet extremely
Yeah.
regularly.
Yeah.
ultrasound
Yeah.
and,
Mm.
and teaching patients to do the same.
Yeah.
I
Mm.
don't know if that's the same everywhere.
Yeah.
Okay.
And the last questions. It's what we spoke about, just to have an international impact for this website. It's an idea to have, or to have other pathologies to include in this project. But maybe it's a second part of this project. We can think about other pathologies like arthrosis. Osteoporosis. It's the same in English, I think. Osteoporosis.
And also,
Sorry. Yeah. Mm. Mm. Yeah.
Lick hypertension was a good one, because that can be very easily numerically
Yeah.
quantified as your average
Mm.
pressure. You respond quite well to
Mm.
exercise and
Mm.
lifestyle interventions.
Yeah.
this kind of chronic mobility.
We use a lot of donepezil and lamantine for dementia. Do you use much of that with drugs?
Yeah, we tried it, and there is more and more studies and new information is coming for side effects about non-effects on the evolution of the disease. So we are stopping this kind of treatments. Because the lost and we found a lot of good effects.
Do you use it in UK and Lamantine and things like this?
So we use donepezil more for mild to moderate dementia and then lamantine for more severe dementia. But it's quite common. Very common.
Other population, the second point.
Yeah, I think. I think about not only rural areas, but on urban
I think
and
we
cities.
have to, other idea could be interesting. It's around about specific population like students,
Yeah. Mm.
because I think we can define some health elements specific to students who have problems to get in touch with medical staff or with their own health. But
Mm.
perhaps it could be a specific population.
Yeah.
About
With-
the self-employed.
Yeah.
They've done quite a lot for sexually transmitted diseases.
Yeah.
With
Sexually
sexually transmitted disease.
MST.
And also about for the younger, about obesity,
nutrition also.
Mm.
You're right that there is a wrong idea about this kind of disease, and it could be interesting to focus on this population. Another and other.
And another questions, maybe it's quite interesting about to speak about the difficulties you can see in this project. It's an ambitious project, but I think there is difficulties.
in my opinion, at the moment, most difficult, the principal difficulty is to share with all the countries.
Yeah.
Because it's quite different with Spain and with UK, and it's really difficult. And it's also difficult to share and to encounter academics, film, pharmaceutical film, or things like this, and other industrial partner. It's quite difficult, but we will try.
Yeah.
Contact this,
To have
contact them, to inform them,
Mm.
to understand them and recognize, because they have to get to have the same definition, to yes, be careful to speak with the same word and same
Okay.
Yeah, and to have the same mind of the project, the same view of the project. Because I think in this project it was quite difficult to have the same view of this project because
problems. Are the problems the same?
yeah, diabetes can
Identify this with a French view, but is it the same for Spanish population? Are the problems the same? I think it's when I did my thesis and the study I presented this morning, that kind of problems are all the same thing about diabetes or chronic mobility patients in rural areas. There's no specific aspects for this about autonomy, about education. All practitioners say that patients have to be more dedicated for their own health, to get more involved in their care.
In France, do you have a website or a place where, which is regulated, where patients can go and research about their condition? Because Google is dangerous. And in England, we have a very specific NHS website for patients to research about their conditions and learn a lot of information in an accessible way. Do you have
We have some very interesting, for example, we have the HAS, the High Authority in Health, which provide some guidelines and areas. We have also many very interesting sites, but the patient, sometimes I say to them, go on this website, this and look. But then they go where they want and they go to sometimes bad information.
Yeah, and this website specifically, it's made for health professionals more than patients. It's technical aspects, and we have to be careful with the guidelines because some of them are not very good and some interest conflict of interest.
So there's no
Specialists.
website developed for patients?
Yeah.
Because we have a website which has two versions.
The
And
NICE,
there's
in the Royal College website and also on the NICE.
no, so NICE is for doctors.
Professional doctor.
NICE
But
is
sometimes
clinical guidance,
Yeah.
and then you have patient.co.uk, and that is tailored for patients with diagrams and explanations in normal language
Okay.
without jargon for patients. So therefore, I print them out all the time.
There are some websites like this with the national agencies.
Yeah.
For example, for contraception, there is a
Yeah.
website like this.
Pediatric.
For sexual diseases, diseases, there are something like this. For tobacco stop, there is something like this. But not for
And as we said, there is many websites. There is not only one website. I think it's more easy for patients to go on one website where we can find all the informations, and not many websites, I think.
exactly. There are a website like this, but it was developed by the insurance, the national social insurance. It's not made for patients.
Yeah.
It was thought by also. It's not useful. It's not. So that's why we have to do research project in order to get the information and we have to put in the website, which is quite useful for efficient for the patient, for the professionals, not something which would be affected by
So thank you very much for your presence. Thanks.
for the small.
Yeah.
Yes, thank you very much to attend.